Hello, my name is Gabriela Guzman, and I'm currently taking a medicine and culture course. For my final project, I decided to do it on mental health, being that it's so prevalent in society, and also I have personal experience with family members that are suffering from PTSD and other mental illnesses. For my research question, I chose, how does society influence mental health diagnosis and treatment in American culture? To start off, prevalence is constantly increasing. Mental illness is very common and even more common for people to just turn the other way. Mental health includes emotional, psychological, and social well-being, and it's important at any stage in life, no matter what age you are. Mental illnesses are treated differently than physical health illnesses. There's a lot of unequal treatment of mental and physical illnesses. There's even discrimination for healthcare coverage for those with a mental illness. It's important to see it more as a physical health issue so that people can get the treatment that they need. Mental health is just as important as physical health. Society isn't educated enough on mental illnesses, which leads to animosity and negative perceptions for those who have one. Instead of turning our backs on people who need our help, we have to learn about the prevalence and importance of living with mental illnesses so that we can accept and help them. This could also help to limit the stigmas in society. It can affect the longevity of life and being able to complete daily tasks. It affects how we think, feel, and act, and it also affects how we handle situations, make choices, and act on stress. Mental health is always important because it affects our overall well-being. It also puts strains on the family. Since getting proper treatment isn't always available, families and relationships can be affected. It can affect the family financially and emotionally. People don't always focus on the emotional and behavior consequences for the families. But looking after a friend, spouse, or family member can be extremely stressful and even traumatic. Now here are some statistics on mental illnesses. In regards to prevalence, 1 in 5 adults in the United States, which is about 43.8 million people, experience mental illness in just 1 year. And 1 in 25 adults, which is about 9.8 million, experience a serious mental illness that limits life activities. 1 in 5 youth aged, which is about 13 to 18 years, and it's 21.4%, experience a severe mental disorder in their lives, and 13% of children aged 8 to 15. With lack of treatment, here are some statistics. Mood disorders, depression, and bipolar disorder is the third most common cause for hospitalization in ages 18 to 44. Suicide is the 10th leading cause of death in the United States. It is the third leading cause of death for people aged 10 to 14, and it's the second leading cause of death for people aged 15 to 24. More than 90% of children who commit suicide had a mental health condition. 18 to 22 veterans a day die by suicide from the stress that they experience during combat or training. Adults with a serious mental illness die on average 25 years earlier than those without. So as you can see, it's very common in society, but it's also very common to go untreated and lead to even worse results, leading to possibly death. After looking at all the literature reviews that I used for my research, here are some methods that they used during their research. They did community-based surveys from those with a serious mental illness. They looked at the media, which shows very negative perceptions towards mental illness. They did drug trials where they gave people a placebo and then they gave another group of people an actual antidepressant. And they showed that there really was not much of a correlation between those that felt like they were better with the placebo and those that felt better with the antidepressants. They did story sharing, where they spoke with those with a serious mental illness, where they shared their stories and explained how it was living in society with a mental illness. They conducted interviews with family members, children, and those with their own illnesses. Some even created recovery programs, such as using more holistic options, and they tried to turn to the environment to help those with a mental illness. They also surveyed environments and social structure or status to see if living for example, in a low socioeconomic status, affected the prevalence of mental illnesses. And in fact, it did. And also personal experience, being that I live with people who suffer from PTSD from the military. For my first literature review, this was from a book called Media Madness, which was public images of mental health. This chapter in the book focused on how the media shows images to the public about different mental illnesses, which will then shape their attitudes and influence their behavior. Through a survey of mental health consumers, they found that 77% of the 1,300 consumers felt that the media descriptions of mental illness are hurtful or offensive. These pictures in the media create a stigma for mental illness, leading to discrimination. Stigmas deprive people of living their life to the fullest and affects their participation in society. The media also plays a part in the negative and misinformed information and the pictures being depicted for mental illness. This shows how the culture of a society focused on media will be harmful for those with a mental illness because of the misconceptions and views a person with an illness or disorder gets. My second literature review was from the New York Review of Books, which focused on the epidemic of mental illness. It talks about how mental illness is growing very prevalent in society. They did a survey with randomly selected adults through the National Institute of Mental Health, and they found that 46% had at least one mental illness at some time in their lives. This also shows that psychiatrists turn to treating with drugs because of a theory saying that mental illness is caused from chemical imbalances in the brain. They believe that the drugs will help to correct the mental illnesses. Irvin Kursich is a psychologist that did a study to see the effects of antidepressants. After 42 trials of 6 drugs, he saw that the placebos were 3 times, which is about 82%, as effective as no treatment. This study shows that administering psychoactive drugs are ineffective and even harmful. This helps me explore how the epidemic of mental illness is being influenced and attempts to minimize the effects that play a part. So as you can see, treating with drugs isn't always the best option. There has to be other options available to those suffering with a mental illness that's healthier for their bodies, not putting more chemicals into their bodies. For my final literature review, it was from the Journal of Child Psychology and Psychiatry. It focused on the stigmatization of mental illness in children and parents. Stigmas are the central issue for problems in mental health. This journal helped to explain the effects of a stigma on a child with a mental illness and a parent with a mental illness. Stigmas lead to stereotypes and prejudice, leading to individuals feeling shame for their illnesses, which will then lead them to not wanting to go get help. There is a need to better society by reducing the negative stigmas surrounding mental illnesses. In regards to a parent having a mental illness, people believe that it will have an effect on their parenting and development of their child. And for children with mental illnesses, it states that it is unknown if knowledge of mental illness affects the development and that from early ages, children hold negative attitudes about labels for mental illnesses. This gives insight on how family structure is affected by mental illnesses and how stigmas need to be reduced to allow for people to be more comfortable with their illnesses and less ashamed. In conclusion, mental illness is very prevalent. Being that it's so prevalent, it's important to be aware and knowledgeable in order to make a change in the statistics on prevalence. Mental health improves quality of life. It is improved because it allows for one to experience and appreciate major events in one's life. Mental health plays a role in the ability to maintain good physical health, and improvement in mental health means improvement in complete psychological well-being. Proper treatment lowers medical costs and future care. If people get the right treatment from the beginning, there will be less expensive than long-term temporary treatments. Also, if people don't speak up about their mental illnesses because of feeling some insecurities or embarrassment from them, then their illnesses go untreated and ends up leading to more expensive treatment in the future. There is a need for more awareness and education. The statistics are so negative towards those with mental illnesses, and it is something that almost everybody experiences at one point in their life. Stigmas need to be let go. If we change the way we think and view mental illnesses, then it could change the way that we approach people with mental illnesses or handle those situations entirely. It is a time for societal change. We are the ones that can make the change, and we are the ones that can better society as a whole. We want everybody to feel included and not feel like an outsider just because of a mental health illness. It is okay to have a mental illness, and it always matters. People should always try and get help and never feel ashamed to. Some implications for future research on this. Moving forward, I believe it is important to make a step towards change. Step away from societal stigmas. There needs to be a less need for using drugs and medications to cure, and more effective treatment options need to be available. If there's more awareness and acceptance, then we could end mental health stigmas and end discrimination towards those with a mental illness. So let's be that change.